So this whole thing began 2 weeks to flatten the curve. And then we flattened the curve, and they said, well, you don't want to be like New York. Of course, they left out that we put all of our COVID patients into the nursing homes. And that really drove up our infection rate, our fatality rate. And in other states that reopened, obviously Florida, Texas, they didn't do that. And then they said, well, you have to stay closed until there's a vaccine. We get the vaccine. They say, oh, there's all these variants. They don't tell us there's 12,000 variants out there already, including one in Europe that drove their entire infection over the summer, and that the virus evolves. It becomes less deadly as it evolves. The whole SAGE working paper on the variant over there was based on a coin toss prediction and based on junk science. I exposed that in January. But nonetheless, we have a new narrative shift today. They're saying herd immunity can't be reached. They used to be against herd immunity because it expensed the vulnerable. Basically, by going for herd immunity, you were saying you were okay with a certain number of people dying. Well, now as we approach the number of people vaccinated, or we've vaccinated enough vulnerable people to the point where the groups that haven't been vaccinated either do not want the vaccine, or they're in a group that is just so low risk that the flu is more deadly, car accidents are more deadly, other things out there are more deadly. So clearly, this is a narrative shift to keep us in lockdown even longer. They're saying herd immunity may never be reached now. But that was never the argument when people such as myself and the other signatories on the Great Barrington Declaration were saying we should have a herd immunity approach, protect the vulnerable. They never said herd immunity was impossible. They just said we wanted to throw, all the old people off of a cliff, which clearly we didn't want to do. We wanted to protect them, unlike Governor Cuomo and Governor Whitmer and all these other people, these governors who put their seniors at risk by putting COVID-positive patients into the nursing homes. So this is just yet another narrative shift by the media, by so-called scientists like Dr. Fauci, when the real scientists like Dr. Carol Sikora aren't really all that worried about variants and herd immunity. They're worried about the looming cancer crisis. These people have been missing their diagnoses, they've been missing their cancer treatments, and real people are going to suffer for that as a result. So be vigilant. This is just another narrative they're putting out there. I'm sure in another month or two, we'll have another narrative shift, but this is the latest one. And they just want to keep us in lockdown forever. People are getting tired of this. I really don't know what else to say.